I'm Paul Hochfeld, and I've been an emergency doctor for 30 years. I've produced a video, Health, Money, and Fear, that asks 3 questions about our healthcare non-system, if you will. Why does it cost so much? What does it say about us? And what can we do about it? We have a $2.5 trillion healthcare factory. It costs us twice as much as most of the rest of the industrialized world. It gives us basically not very good results. What's more is 60% of it is funded by taxpayer dollars. What's even more interesting is that the private health insurance premiums that you or your employer are paying are inflated by 15%, maybe even as much as 20%, to cover the cost of the uninsured. Essentially, we're all paying for everybody anyway. Now, if we look inside of this $2.5 trillion factory, what we find are a lot of independent economic entities. Doctors, clinics, hospitals, insurance companies, drug companies, medical supply companies, malpractice insurance companies, and lots of lawyers. And they're all trying to do the same thing, which is to make a profit. As it turns out, there's nobody in the system that's responsible for asking the question, how do we get the most health and the least suffering for our health care dollars? Even worse than that, as a provider, the way to make profits in this healthcare factory is to invoke very expensive technology to keep very sick people from dying or from not being quite so sick. There's very little money, very little profits to be made in keeping healthy people healthy, or what's more important, keeping people with chronic illnesses from stumbling into the ranks of the ill. So the magic of the marketplace actually ensures that there's lots of really sick people to take care of. Now, there's lots of reasons why it costs so much. There's the advances in technology, which gives us more expensive ways to deal with more problems, sometimes with just marginally effective results, but it is more expensive and it is effective. There's the fear of liability that dictates that physicians use every crumb of technology available. There's the mass marketing of prescription drugs, the disappearance of primary care providers, the chaos of medical records, and finally, there's all of these insurance companies. If you look inside this factory and assume there's 10 floors to the factory, the top 2 floors, fully 20% of it, are people fighting over money that aren't contributing anything to what should be the product, health. Getting rid of all of these insurance companies and having a single payer, if you will, is not just about getting rid of all the insurance companies and saving 20%. It's about having a system with a publicly accountable entity that's responsible for making the really important decisions and difficult decisions that need to be made to take care of all of those other drivers on cost. Now, make no mistake about it, we have to control cost. The cost of healthcare is a cancer to our economy, causing bankruptcies, causing unemployment. In the year 2025, if nothing changes the current trajectory of costs, the average family premium will be the average family income. Clearly, that's not sustainable. And I predict that eventually we're going to have single payer, because it's the only way to control costs. Whether it's in 5 years or 10 years or 30 years, that's really the only question in my mind. And the reason we're trying to do it sooner rather than later is to avoid the implosion that will happen if we don't do it sooner. Fixing healthcare, as it turns out, is less about healthcare than about the political process that's broken for the same reason. They're both mostly about money. And when our congressmen tell us that single payer is politically not feasible, what that means in plain English is that if they support single payer, they're afraid they won't get the really important campaign financing they need from the industry in order to pay for media ads in the next round of elections. We've heard a lot of talk lately about the public plan option. And the public plan option actually could be a step in the right direction, but I also think it might be a trap. We know that the industry has a huge amount of influence on public policy. And when the rules of engagement for this public plan option are created in order for there to be a level playing field, the playing field will not be level. The playing field will be tilted, and the sickest, oldest, and most expensive patients will gravitate towards the public plan by design. And when the public plan starts to struggle because of the unfair demographics 3 years from now or 4 years from now, the industry are going to look at the public plan and they're going to say, see, single payer won't work, and it'll be the wrong lesson. I fear that the change that we're going to get from this Congress is going to be no change at all. It's going to be more government subsidies for the insurance companies so they can continue to thrive, being central to a dysfunctional healthcare system that's better at producing profits than health. We have to contact our congresspeople and tell them we want real change that both controls costs and covers everybody. We want them to put single payer on the table and let the Congressional Budget Office do the math and tell them if it will work. What the CBO's been telling them up till now is that they haven't suggested anything that's going to work, and until they put single payer on the table, that will continue.